Hello, and thank you so much for joining me today. My name is Melissa Devine, and I am with the Area Agency on Aging 1B's Medicare Medicaid Assistance Program. And I'm here today to talk to you about Medicare coverage of vaccines. Today, we're going to cover what MAP is, what we do, Medicare's coverage of vaccines that are covered by Part B and Part D. Let's get started with MAP Inc. MAP counselors are certified and have been trained in healthcare benefits counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they're not licensed to sell insurance. In many states, MAP is referred to as the State Health Insurance Program, or SHIP. But again, we're located all across Michigan, offering free health benefit counseling assistance with our unbiased counselors. So MAP Counselor can help you understand Medicare health plans, compare and enroll in Medicare Advantage coverage, compare or enroll in Medicare prescription drug coverage, identify and report Medicare and Medicaid fraud and scams, and assist with enrollment into low-income programs like the Low-Income Subsidy Extra Help Program or Medicaid. Now let's take a minute to understand Medicare. Medicare is health insurance for three groups of people: those 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease or ESRD. It is administered through the Centers for Medicare and Medicaid Services. However, enrollment into Medicare does take place through Social Security for most and the Railroad Retirement Board for railroad retirees. Medicare has well-defined benefits and exclusions, and it does not typically cover dental, vision, or hearing except under special circumstances. It also does not cover long-term custodial care. It places certain limits on care items such as physical therapy, durable medical equipment, and more. And it does not cover over-the-counter medication. Medicare, though, does work with private insurance companies to provide Part D prescription drug coverage, supplemental or Medigap plans to help fill in the gaps in the original Medicare, and for Medicare Advantage plans that combine the parts of original Medicare, usually with prescription coverage, and often some dental, vision, and hearing coverage. There's 4 parts to Medicare. Part A is the hospital insurance, Part B is the medical insurance, Part D is the prescription drug coverage, and Part C is Medicare Advantage. Those are the HMOs and PPOs that combine Parts A, B, and D into one policy. Now let's take a look at the Medicare vaccine coverage. Medicare covers many vaccines, including the ones listed here: the flu, tetanus, diphtheria, pertussis, pneumonia, shingles, and even others like your MMR, hepatitis A, hepatitis B, even your COVID-19 vaccines and boosters. As always, we always want to make sure that you consult with your doctor or pharmacist on what vaccines are recommended for you. Now, there are certain vaccines that are covered under Medicare Part B. Influenza, also called the flu, is a virus that can cause fever and other symptoms. Flu shots can help prevent seasonal influenza. Medicare Part B covers 1 flu shot every flu season, including the high-dose flu vaccine. The flu season usually runs from November through April. Depending on when you choose to get your flu shot, Medicare may cover a flu shot twice in 1 calendar year. For example, if you get a shot in January, you could potentially get another shot in November for the following flu season. If you qualify, Original Medicare covers flu shots at 100% of the Medicare approved amount when you receive the service from a participating provider. This means that it's no cost to you, that there's no deductible or coinsurance. Medicare Advantage plans are required to cover flu shots without applying deductibles, copayments, or coinsurance when you see an in-network provider and meet Medicare's eligibility requirements for the service. Pneumonia is an infection that targets the lungs and can cause fever, difficulty breathing, other severe symptoms, and death. Pneumonia shots help prevent pneumonia. Medicare Part B covers 2 separate pneumonia vaccines. Part B covers the first shot if you have never received Part B coverage for a pneumonia shot before. You're covered for a different second vaccination 1 year after receiving the first shot. You're not required to provide a vaccination history when receiving the pneumonia vaccine. You can verbally tell your healthcare professional that's administering the shot if and when you've received past shots. If you qualify, Original Medicare covers the pneumonia shot at 100% of the Medicare approved amount when you receive the service from a participating provider. This means that you pay nothing, no deductible or coinsurance. Medicare Advantage plans are required to cover pneumonia shots without applying deductibles, copayments, or coinsurance when you see an in-network provider and meet Medicare's eligibility requirements for the service. Hepatitis B is a virus that attacks the liver and can cause chronic liver disease. Hepatitis B shots can help prevent the disease. Medicare Part B covers the hepatitis B vaccine if you're at medium or high risk for hepatitis B. Medicare considers you at medium or high risk if you, for example, have end-stage renal disease or ESRD, have hemophilia, are a client or a staff member at an institution for the developmentally disabled, live in the same household as a hepatitis B carrier, have unprotected sex with multiple partners or with someone who has hepatitis B, if you use certain injection drugs, or are a healthcare professional in frequent contact with blood or other bodily fluids during routine work. Note that if you are at a low risk for hepatitis B, the shot will be covered under Part D. If you qualify, Original Medicare covers hepatitis B shots at 100% of the Medicare approved amount when you receive the service from a participating provider. This means you pay nothing, no deductible or coinsurance, and Medicare Advantage plans are required to cover hepatitis B shots without applying deductibles, copayments, or coinsurance when you see an in-network provider and meet Medicare's eligibility requirements for the service. Original Medicare Part B covers COVID-19 vaccines, regardless of whether you have Original Medicare or a Medicare Advantage plan. You will owe no cost sharing, deductibles, copayments, or coinsurance. Speak with your doctor to learn more about the vaccine. You can also contact your state or local health department for more information too. Make sure that you bring your red, white, and blue Medicare card with you to your vaccination appointment, even if you have a Medicare Advantage plan. You do not have to have your card on you. Your vaccine provider will ask for your Social Security number so that they can look up your Medicare information. The FDA has approved an additional dose of the COVID-19 vaccine or boosters for certain at-risk populations and people 65 or older. Any additional doses will be covered by Medicare with zero cost sharing. So speak with your healthcare provider to learn more about your eligibility for further doses or boosters. Be aware of fraud schemes that are related to the COVID-19 vaccine. Scammers may still attempt to bill Medicare for sham tests or treatments related to coronavirus and target individuals to illegally obtain money or Medicare numbers. Remember that the following to avoid experiencing fraud related to the COVID-19 vaccine. You should never share your Medicare number with anyone except for trusted healthcare providers. Be wary of people who ask for your financial information. The vaccine should not cost you anything. And avoid posting photos of your COVID-19 vaccination card on social media, as the information on it can be used to steal your identity. Contact your senior Medicare Patrol or SMP if you suspect that you've been experienced a Medicare fraud situation. If you would like to reach out to somebody for that, you can give us a call at 800-803-7174. Now let's take a look at the vaccines that are covered under Medicare Part D. If your provider recommends that you get a vaccine, in most cases, it's going to be covered by your Part D plan or your Medicare Advantage plan's prescription drug coverage. Part D plans must include most commercially available vaccines on their formularies, which is the list of covered drugs, including the vaccine for shingles. And the only exceptions are flu, pneumonia, hepatitis B if you're high risk, and COVID-19 vaccinations, which are covered under Part B. As of January 2023, all Medicare-covered vaccines are free to you. This means that you should not owe any cost sharing, such as a copayment, coinsurance, or deductible for your covered vaccines. To avoid billing issues, it's usually best to make sure that your healthcare provider or pharmacy that's administering the vaccine will bill your Part D plan. When you get a vaccine at your doctor's office, ask the provider to call your Part D plan first to find out if your provider can bill your Part D plan directly. Now, just a quick look at Medicare wellness and preventative services. Medicare Part B covers more than just your vaccinations. It also covers preventative services like screening exams, wellness visits, lab tests, and more. Preventative services may help find health problems early when treatment is going to work best. You must have Medicare Part B for Medicare to cover these services. These services are covered no matter what kind of Medicare health plan you have, but the rules for how much you may pay for these services may vary. So talk with your doctor about which preventative services you need, how often you need them, and if you meet the criteria for coverage based on your age, gender, and medical history. Preventative services costs under Original Medicare. Under Original Medicare, you're going to pay nothing for most preventative services if you get the service from a doctor or provider who accepts assignment to Medicare. For some preventative services, you'll pay nothing for the service, but you may have to pay a coinsurance for the office visit when you get the services. If you are in a Medicare Advantage plan or other Medicare plan and get Medicare-covered preventative services, you may have to pay the plan's copayments. For those that are new to Medicare, you get a Welcome to Medicare visit with your doctor. It's a great way to get up to date on important screenings and shots and to review your medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B, but during the exam, the doctor will review the following: medical and social history, your height, weight, body mass index, blood pressure, and even a simple vision test. There's the review of potential risk factors for depression, a review of functional ability and level of safety, which is hearing impairment, your ability to successfully perform activities of daily living, fall risk, and home safety. Individuals will get advice to help them prevent disease, improve health, and stay well. You'll also get a brief written plan, like a checklist, letting you know if there's any additional screenings or preventative services that are needed. At this time, the doctor may also refer for additional Medicare-covered screenings if the referral is as a result of your initial Welcome to Medicare visit. There's no cost if the doctor accepts Medicare assignment, and this is a great benefit that people can take advantage of. Medicare also covers a yearly wellness visit. So after you've had Part B for longer than 12 months, you can get an annual wellness visit to develop or update a prevention plan just for you. The Medicare annual wellness visit is every 12 months, and during that visit, the doctor will record your blood pressure, height and weight, review your potential risk factors for depression, review your functional ability, your level of safety, including hearing impairment, the ability to successfully perform daily activities of daily living, and fall risk and home safety. The doctor is also going to give you advice to help you prevent disease, improve your health, and stay well. And you'll get a brief written plan, like a checklist, letting you know which screenings and other preventative services you need over the next 5 to 10 years. You don't need to get the Welcome to Medicare visit before getting an annual wellness visit. But if you choose to get the Welcome to Medicare visit, you'll have to wait a full 12 months before you can get your first annual wellness visit. Again, you'll pay nothing for this exam as long as the doctor accepts assignment to Medicare. In addition to your Welcome to Medicare visit and your yearly Medicare visit, Medicare also covers several other preventative and wellness services. The next few slides review what's covered and what the cost would be for you. You can see here that Medicare will cover cardiovascular disease screenings, mammograms, colorectal cancer screenings, colonoscopies, prostate cancer screenings, again, flu shots, pneumonia shots, bone mass measurements, glaucoma testing, diabetes screenings, Pap test and pelvic exams, HIV screenings, COVID vaccines and boosters, the shingles vaccine, and tetanus, diphtheria, and whooping cough vaccinations. Now, just a quick look at Medicare fraud and abuse. Medicare fraud is the most common scheme that affects Medicare beneficiaries. It can be as simple as Medicare or Medicaid being billed for services that you never got, equipment that you received and returned. It can be someone using your Medicare or Medicaid card for services, or even a company that uses false information to mislead you into joining a Medicare plan. All of which are things that you will want to report to your local SMP, and that's MAP. So give us a call at 800-803-7174 if you or someone you know has been a victim of Medicare fraud. MAP is here to help. So if you'd like to speak with a MAP counselor about your specific situation, just give us a call. We're currently counseling over the phone, Zoom, and in person where available. Our services are confidential and unbiased, and there is no question that's too trivial. We often deal with very complicated questions as well. And for more resources outside of MAP, you have access to the Medicare and You Handbook, which is going to be sent to you each fall. However, if you haven't received that, you can access an electronic version all year online from Medicare.gov. You also have access to Medicare's website, that's Medicare.gov, or you can always call 1-800-MEDICARE. But for your most up-to-date local information, you'll want to reach out to MAP. Our services are free, they're unbiased, and our certified counselors are not sales agents, and they're not affiliated with private insurance companies. So we can be your best resource for any and all questions and concerns Medicare. There is no question that's too small or difficult, and we've saved over $2 million for beneficiaries in your area alone. And just a quick word from our funders. That would be the State Health Insurance Assistance Program and the Senior Medicare Patrol. And if you have any questions or if you would like to connect with me personally, here is my contact information. Again, my name is Melissa Devine. My email is mdevine, and that's DEVINE, at AAA, the number 1, B as in boy, .org. Thank you so much for spending time with me today. I hope that you have a wonderful day.